video is intended as a very brief review for your lung volume recruitment maneuver or cough assist. You or your client will have already been set up with a cough assist bagger if needed. Once again, this video is just a review for those clients who have been set up with a cough assist bagger or lung volume recruitment bagger by a PROP respiratory therapist. To perform this maneuver, you will require a bagger. This bagger is not for resuscitation. This bagger is for the lung volume recruitment maneuver or the cough assist. You have the bagger. Attached to the bagger, you have a one-way valve. Attached to the valve, you have corrugated tubing and either a mouthpiece or a face mask and nose clips. I'll go over the mouthpiece first. So I'll give you those. So big breath in and hold. Big breath in and hold. Big breath in and hold and exhale when ready. Great. So I'll just explain what we did there. Miranda held the mouthpiece tightly and secure in her mouth with a tight seal around her lips. It's very important that when you're doing the lung volume recruitment maneuver for your client that you have verbal communication about what you're doing. So the first breath, you're going to squeeze and let the client inhale, and then you're going to let the bagger re-inflate. We're going to do that approximately 3 times. On the 3rd time, the client's going to hold their breath, take the mouthpiece out, and exhale forcefully. We generally recommend one treatment is 3 breaths and then allowing the client to exhale fully after the 3rd breath. However, every client has their own individual needs. Some clients will perform this maneuver using 1 or 2 breaths or as many as 4 or 5. You just have to communicate clearly with your client and ask them how they perform their lung volume recruitment maneuver or cough assist. In the next demonstration, Miranda is going to do the maneuver herself. If your client has the dexterity and the strength in their hands, they can perform this maneuver themselves. Thank you. Great. If you or your client cannot perform a tight seal with the mouthpiece, we do have the face mask. So there you just detach the corrugated tubing, attach the face mask. So once again, we have the bagger, the one-way valve, and a face mask. The procedure is the same. The interface on the face is the different part. And you just want to make sure the mask has a tight seal, once again communicating with your client. Big breath in and hold, big breath in and hold, big breath in and hold, and exhale when ready. So just to wrap up, once again, what we reviewed in this video. This bagger is not meant for resuscitation. This bagger is your lung volume recruitment maneuver bagger or your cough assist bagger. You or your client will have already been set up by a PROP respiratory therapist with this bagger if you require this maneuver. If you or your client has any further questions, please contact a PROP respiratory therapist about the lung volume recruitment maneuver or the cough assist bagger.